I think what we need to be assured that it's going to be independent. We need transparency, and we need involvement of the key stakeholders from groups that were impacted the most. And, that's the bereaved families, clinically vulnerable parents, educational staff, healthcare workers, and, the disabled community. So it needs to be something that listens to those voices and delivers on us understanding how the failures during the pandemic had this devastating impact on so many people in terms of lives lost, those bereaved, long COVID, impacts that will last for many, many, many years to come, including on the NHS, on the economy, and on our society.
How prepared do you think we were for the pandemic?
I think we were very, very poorly prepared. That is very, very clear. What disturbs me more than the poor preparedness during the first wave is the fact that a lot of the failures continued over time, and they weren't very clear just in hindsight. They were clear when they were happening, and they went against scientific advice even at the time. And I would like to say those failures are continuing now. So in no way, are those things over. We are in the fourth wave. Just this year, we're continuing to see deaths. We have 2 million people living with long COVID, and we're continuing to see more and more people bereaved, particularly people dying in the clinically vulnerable, disabled, and elderly groups. And I think we really need to understand why that was allowed to happen and is continuing to be allowed to happen. Of course, the inquiry won't address all of those parts, but I think if it addresses what happened, at least in the last few years, we can hopefully learn lessons from that moving forward, because I don't feel like that's happened.
And how concerned are you about future waves?
I mean, very concerned. We're obviously in the middle of one. There's absolutely no reason we shouldn't continue to have big waves. We have new variants already on the horizon that are expected to become dominant within a few weeks. And this pattern is likely to continue unless we take action in terms of air quality to actually suppress infection going forward. And, this will lead to, unfortunately, more people living with long COVID, more people disabled, impacts on the economy that we're already seeing, and huge impacts on the NHS, which are already apparent, and people dying additionally from other diseases because of that.
Is COVID still the threat it once was?
So, definitely the threat level has reduced because we have vaccines, but is it still a threat? Absolutely. So we've had more than 24,000 deaths from COVID this year, which is more than what we have in a whole year with influenza and pneumonia, not just influenza. And in terms of long COVID, it's caused devastation. We have 2 million people living with long COVID. Many of them are disabled. The Bank of England has warned us that we have more people out of work than we've had for decades before, suggesting this is also now impacting the economy. The healthcare service is absolutely on its knees. I mean, we have people dying because they can't get to the hospital in time. And when they get to the hospital in time, they can't get care in time. I mean, this is it's a crisis. Unfortunately, many people don't realize it unless they're directly impacted. But if you have a stroke or heart attack, there's no guarantee you can get care in a timely manner, which is honestly terrifying. And unless we accept that we need to respond to the pandemic rather than deny it, I really worry that we will continue to have many more people suffer and become disabled over time.